Hello and welcome to another episode of Rewiring Health. I'm so overjoyed to be joined with by Dr. Marianne Miller. Marianne Miller is an eating disorder psychotherapist and binge eating educator in San Diego, California. She works with people with all types of eating disorders, including anorexia, bulimia, binge eating disorder. And Dr. Miller also has a long history of seeing individuals with eating disorders and chronic pain, and she really understands the complexities that come with both conditions. After having a full-time academic, after being a full-time academic for 12 years, and having a private practice as a side gig, Dr. Miller left university life to treat eating disorders full-time in 2018. She hasn't looked back and adores the work she does. In addition to providing therapy, Dr. Miller now offers a virtual 5-week eating disorder class called Freedom from Binge Eating. She is passionate about educating people about eating disorders and loves to teach people how to learn to escape the binge eating cycle. So welcome, Dr. Miller. I'm so happy that you could join us today.
Thank you so much for having me, Kelly.
Yes, absolutely.
And you can call me Marianne.
Marianne. Oh, very good. So we connected probably a few weeks ago, and what fascinated me about you is that you work with individuals who both have eating disorders and chronic pain, which is very similar to what I do as well. And we were just saying how much of a need there is for that. Do you mind just sharing how you got started with that?
Sure. I did graduate school in Texas and got my PhD from Texas Tech University. And it was kind of interesting because I was working at a full-time clinical job, and then I had a side gig. Me and my side gigs as in private practice, and I was seeing a few clients with chronic pain. Just kind of happened. It wasn't the presenting problem. And then like a month after I got my PhD, I had an accident snowboarding, and I injured my back. And so it was my own journey. Like I had it's a very long and convoluted story, but eventually I ended up getting back surgery. It didn't take. I got like staph infection. I was like bedridden for 3 months and all that stuff. And then when I came back, I was to my side private practice. I was really in tune with my client's, chronic pain experience. And I vividly remember I had a TENS unit on my back, which those of you who don't know, it's like these little sticky things with electrical wires that they do. It's like what they put on your chest for echocardiograms. And then it's attached to this like battery pack that's put on, you kind of hang on your belt or pants or whatever. And it provides electrical impulses that help kind of, it's like distracts you from the pain, I guess. And so I had a TENS unit and I was doing therapy, and my client, like he was like talking, and then all of a sudden he stopped and he said, "Is that a TENS unit?" And I said, "Yes." It's like, "Do you have chronic pain?" I said, "Yes, I have chronic back pain." And then all of a sudden, and this was a client that I was really having a hard time connecting with, and all of a sudden just everything kind of opened up, and he was like, "Oh, she gets me." And I was like, "Oh, okay." And then I kind of and then my therapy experience with him just became really, really good, and he did very well. And then just by word of mouth, I started getting more people with chronic pain. And then when I moved here for an academic position in '06, that was going to be my clinical focus, was chronic pain. And I started a chronic pain support group and all that stuff. And then what I found is that a lot of people with chronic pain had disordered eating. And so there was an eating disorder class offered at the university where I taught. and so it was over the summer, I audited it, and I was able to just like really dive into eating disorders. And I'm like, wow, this is like really cool and complex, and I love it. And so I ended up kind of getting a ton of training. I really dug deep into the training. And so now I had all this skill set and this experience of working with people with chronic pain. And then I saw the intersection with people with full-fledged eating disorders. And I just really got it. And my clients really appreciated the fact that I got the complexities of both of them. Yeah,
absolutely. Yeah. And I think two things that I kind of took from that too is like, it's amazing how, some of our struggles become our greatest strengths, and you talk about your chronic pain experience. It ended up being such a gift to you later on with your ability to connect with people, it sounds like.
Yeah, it did. And I had my own eating disorder history in the past. I'm long recovered. And so like I knew from how the chronic pain can trigger eating disorders, and then I knew from my clients, or chronic pain can trigger eating disorder behaviors, because mine flared up a little bit after I got injured, and then I had to learn how to work through that, and I did, and then with my clients, I saw how sometimes eating disorders can itself cause chronic pain, and like a lot of the work that you do. So it's and then one causes the other, which triggers the other. The pain triggers the eating disorder behaviors, which triggers the pain, and you're caught in this infinite loop.
So it's such a vicious cycle. And I think
it really is
so important to address both, not only just the body, but the mind, the spirit, the emotional aspects of it. And I think without having that all-encompassing approach, when things get left out, you do kind of get that like, oh, my pain is better, but the eating disorder is getting worse, and vice versa.
Exactly. Yeah. It sometimes feels like it's kind of like whack-a-mole.
Yes, absolutely. Yeah. And they are both extremely complex, and many people have experienced them for years. So you have a lot of layers.
Oh, decades.
Yeah. Absolutely. Yeah. And I think it's so important to talk about that too, and how they relate to each other, because from my experience, I've gone through both an eating disorder and chronic back pain myself. And I had the eating disorder, and then I got the back pain from that. That was more my experience. But I find a lot of people don't make that connection, that they are related.
They don't.
Yeah.
No.
And how did you kind of discover that? I know with yourself, you experienced that, but have you seen people kind of have this, like your clients, like have a wake up call, like, wow, they're both very much connected?
Through therapy, yeah. I think it's a lot of times it's hard for them to make the connection on their own, because when people are in such chronic pain, they're trying to do anything to help themselves feel better. And so a lot of that, I think that's where diet culture can come in. It's like, well, if I can eat a particular way, or cut out this particular food groups, or these 5 food groups, and then it'll help my pain. And 9.9 times out of 10, it doesn't help their pain. It actually makes them more stressed out, because it's a lot harder to eat restrictively, and increased stress causes more pain. And so for them to be able to see all those connections, it's challenging. I think people tend to compartmentalize it. When I went through my experience, and I actually had the eating disorder prior to the pain, and then and then it was getting better, and then I injured myself, and then everything kind of flared up, and I had to deal with both in my own therapy at that time. And so, and as I got better, as I healed through my eating disorder, it was kind of a concurrent or a parallel process where I was healing in my eating disorder, and I was healing in my ability to manage the pain, and then the pain got a lot better. So thankfully, that's not always the case with people. It was for me.
Yeah, absolutely. And I think that's such an important thing to talk about too, because I feel like with chronic pain, there's always that word management, and that's kind of where people feel like their ceiling is. But can you kind of talk about how, maybe with your experience or other people's experience, how it is actually possible to heal from chronic pain and to actually improve your life?
Yeah. I mean, I was very convinced that that I was going to have that level of pain for the rest of my life, that I was going to be on some kind of pain medication for the rest of my life. And so again, I had an amazing therapist who was an eating disorder therapist and just really got the chronic pain piece too, even though she wasn't a chronic pain specialist. And so we just worked on emotion management and stress management, and learning to listen to my body, learning to trust my body, learning to become friends with my body, and even friends with the pain. Because if the pain is occurring, that's my body telling me something. It's telling me I need to lay on a heating pad, or telling me I need to take some medication, or I need to lie down, or take a day off, and she helped me learn how to set a lot of boundaries in my life, so it just wasn't exacerbating the pain so much, which in turn helps the eating disorder. And then she also helped me with the eating disorder, which in turn, and then I was less stressed about eating and less stressed about body image and all that stuff, and that in turn helps the pain. So you really got to address both. And then with people that I work with, I mean, I do the same thing, and is that you have to address both pieces. And to some of my clients, their pain improves. Some of them, they don't. It doesn't. It's a mixed bag. And what I can say about chronic pain, it's less about learning how to quote like solve it, and more about learning how to become friends with it. And when I tell my clients that, they're like, "You're crazy," and I'm like, "Yeah, I am kind of crazy." and it works. And there's a type of therapy called dialectical behavior therapy that's based in mindfulness, and they have this notion of radical acceptance, and it's just kind of learning how to radically accept anything in your life, whether it's physical pain, emotional pain, psychological pain, whatever. And when I was doing that before I even knew about dialectical behavior therapy. That's what I was doing in my own life, in becoming friends with the pain and radically accepting, okay, it is what it is, because the more you fight against it, the more your muscles tense up, and the more stress you feel, which creates more pain. And so I talk a lot about that, and my clients is just, it's like, how can we move toward radical acceptance, in terms of the pain. And, sometimes my clients have chronic illness and stuff like that.
Absolutely. And I think that's such an important point to make, is that learning how to trust yourself and accept your situation is such a huge stepping stone towards healing, because I've experienced the same thing. The more you resist it and you get down on yourself and you're shameful and you feel guilty for why you're living your life the way you are, or experiencing what you're experiencing, the more things amplify, and it's like it becomes such a vicious cycle. So I'm so glad that you brought that up. It's such an important point to make. Excuse me, let me just go back here. So I find it so interesting that how you kind of evolved as far as, your own experience and then to helping others. What is your philosophy on healing from an eating disorder or chronic pain? What is kind of your method or system?
Sure. So if you picture a three-legged stool, and each leg of the stool is an approach to therapy that I use. The first leg of the stool is cognitive behavioral therapy. So in that, we look at changing people's thoughts around unhelpful thoughts around food, eating, and body image, and then unhelpful behaviors around food, eating, and body image. So, whether it's kind of really ruminating or, thinking obsessively about food, eating, and body image, or whether it's binge eating, binging, purging, restrictive eating, all that stuff, we're really targeting on, reducing and eliminating those behaviors. And with that, we really build a toolbox of coping skills that people can use to help change those unhelpful thoughts and unhelpful behaviors. And then the second leg of the stool is dialectical behavior therapy, as I mentioned, which is based in mindfulness. And so with dialectical behavior therapy, or DBT, the client and I really focus on learning how to identify and manage their emotions. And excuse me, it's interesting, and I think especially with people with chronic pain, is that people can be either over aware of their emotions, like the emotions hijack them, or I think with chronic pain, people tend to be a little under aware of what's going on with themselves emotionally. And so we have to be like, okay, yes, you're feeling pain. What's going on for you emotionally right now? Because sometimes, I think pain can mask the emotional experience. And so with that, we identify the emotions, and I teach them how to improve their ability to tolerate distress. And that also goes with chronic pain as well. So it could be distress in the weight restoration process for someone with eating disorder, with anorexia, the distress of not purging with someone with bulimia, and then, the distress of dealing with the pain. Because sometimes the eating disorder is, people use eating disorder behaviors to cope with, it's a way also to get a little dopamine boost to help their pain feel better, whether through restriction or binging purging. And so it makes sense, so improving their distress tolerance, and then continuing to add to that box of coping skills to help them when they are feeling distress and when they're feeling the urges to engage in the eating disorder behavior. And then the third leg of the stool is exploring any past or present family issues that may have contributed to the development of the eating disorder. And then I kind of broaden that also to, past or present romantic relationships, with a lot of the teens and young adults. And sometimes, through their, like millennials, we look at social media, like, what are you looking on? Is that helpful? Is that not so helpful? Right. And so, do you need to start setting boundaries with people who are talking about diets all the time and say, like, I don't want to be talking about this? Or people are like, well, your pain would just get better if you eliminated these 10 things from what you ate. And it's like, okay, which will cause you stress, which will trigger more pain. And so people just don't see that. So addressing those, learning how to set boundaries, really amplifying the person's voice, and well, first like getting them to get in touch with their voice and their authentic self, and then encouraging them to amplify it, and so they can feel empowered.
Yeah, no, I love that. Yeah. I love how you incorporate the environmental impacts of that as well. That's huge. I think especially more now than ever, there's so many influences that bombard people, and it's like kind of working through that and being able to be in touch with yourself. And
oh, absolutely.
Yeah. And I also like how you touched on, because this is such a huge thing with, chronic pain eating disorders, that either hypersensitivity to your emotions or the numbness. And, that is, that's completely what, I've experienced. And you don't even realize how numb you are to your own emotions until you start kind of working through the healing process. So I think that's so important to realize, because, when you have an eating disorder, it's usually a longer term thing. And you gradually, for me, it was numbing. Like I just numbed myself with that. And, it was so important to realize how disconnected you are from your own self when you're going through that.
Disconnected from your emotions, and also disconnected from your body.
Yeah.
And that's so tricky when it comes to chronic pain, because like people want to be disconnected from their bodies, when it comes to chronic pain, because their bodies have become the enemy in many ways. And so to teach them to learn how to become friends with their body, and it's like, no, your body is this, they're communicating some, it's your body's telling you need something. And that's really, really hard. It's really hard. And I think it would be difficult for me to get this unless I had experienced like severe chronic pain myself, because I know how bad it gets.
Yeah.
It's horrible. And my heart goes out to anyone who has to deal with that.
Absolutely. Yeah. And I think it is so important to make that transition from animosity towards yourself to recognizing that everything you're experiencing is actually a big advocate for yourself. And, I think, unfortunately, I don't know what your experience is with this, but a lot of the individuals I've worked with, the medical system has failed them time and time again.
Oh my God.
Like,
you spent so much time talking about that.
Yes. Like, and that's, I think, perpetuating this.
Yes.
I can speak more on chronic pain, but it perpetuates the problem where it's almost like this kind of medical gaslighting. Like you have this issue, you're looking out for help, and then they kind of put the blame back on you that, either you're lazy, you're overweight, or, you have all these things going on that this is why you're not healing. And I think it's just continuing that. Can you speak on that a little bit, what your experience is?
Yeah. Like I can speak on that for like 5 hours.
Unfortunately, there's a lot that goes on with that.
Oh my God.
Yeah.
And I mean, when I ran my chronic pain group, that's what we would talk about a lot. Is they just wanted to feel like they felt heard and understood with how awful the medical system is, because the medical system is, to a large degree, quite clueless when it comes to treating chronic pain. And I mean, I think it is better today than it was, back in 2005 when I had my back surgery. But it's still, I mean, I remember going to a pain doctor, and just like, I was just crying because I was in so much pain. And she said, oh, it's just anxiety. And she gave me some anxiety medication, this is when they would write out the scripts on a pad. And I just like ripped it up in the office. And I was like, I'm not seeing you ever again.
Yeah. Oh my gosh.
Yeah.
It makes it worse. It makes everything worse when you feel like you're getting your back turned on.
Right.
Yeah.
Right. Because you feel so helpless and hopeless. And I spend a lot of time talking to clients about that and working through it, their anger and their disappointment, and frankly trauma from the medical system. If a surgery goes wrong, if they've had certain situations where they were in the hospital and they weren't able to get the care that they needed, that could be really terrifying. So
yeah, absolutely.
And compounds the pain.
Oh, definitely. Well, you're trusting, you go into a medical appointment trusting that the person is going to have your best interest in mind. And a lot of times you're left feeling just completely shut out from anything. So it's like, healing, hope is such a crucial part of healing. And when you're, failed every time with a medical person, that's what, how they say, oh, you failed treatment. It makes you lose that hope, and it just compounds everything. Yeah.
And when I tell clients, I say, a lot of times people have to find a combination of things that work for them. And in terms of what helps with chronic pain, and I said, it's like a bowl of spaghetti that, the whole thing, if you want to see what spaghetti sticks, whether spaghetti is ready, you throw it on the wall and see whether it sticks. We're just like throwing this huge big bowl of spaghetti at a wall and see what sticks.
Yeah.
You just have to try a bunch of different things.
Yeah.
And a bunch of different providers. And that, it's like in the last, people with chronic pain, they feel terrible. The last thing they want to do is like hop from doctor's office to doctor's office. And I get it. I've been there. And it's just like, okay, there are providers out there. You just have to be patient and trying to find the right one, and then maybe combining that with like some like Eastern medicine approaches or whatever, like acupuncture. I don't even know if that's considered Eastern medicine anymore, but like chiropractic, acupuncture, just like whatever happens to work with the person. And it is totally not one size fits all, because one thing, like I've had acupuncture work amazing with some of my clients, and it's FDA approved to work with lower back pain. And then I've had clients who had horrible experiences with acupuncture, and it's an absolute mixed bag, but they have to be able to try all these different things. So giving them hope, I think, is also like, and I think I typically am not like telling my clients all about my story, in general. When it comes to chronic pain, however, I do disclose, that I have a chronic pain history, because they need to know that I get it. Because there's some, like, vast majority of people in their lives, if not everyone, doesn't get it. So that helps them tremendously. Do you disclose to your patients?
Yeah, I'm very open about my chronic pain experience. I experienced it very young in my 20s. So I
Wow.
kind of freaked out. It was right after I had recovered from my eating disorder, and then I had chronic back pain for several years. And it was, I went to providers, and they're like, oh, your disc height is this, it's never going to get better. You're only going to get worse. And, I lost hope myself for several years, thinking, oh my gosh, I'm in my mid 20s. What is the rest of my life going to look like?
Right.
So,
I was 30.
Oh, you're young too. Yeah.
Yeah, I was young.
Yeah. And you have your whole life ahead of you. You need your back, you need to function. And, when you lose hope early, you're like, oh my gosh, like you think it's only going to get worse. And it's scary, very scary when you're going through it. So
yeah, and sometimes medical providers tell you, it's just like, well, you're going to be living with this for the rest of your life.
That's it.
And that sucks to hear when you're so young and you still have so much of your life to live.
Absolutely. Yeah. It's debilitating in that moment. It's like kind of getting over that mindset, like, wow, I don't have to believe that story. That's not my story,
Exactly.
It's so important.
Exactly.
Kind of flipping it to a more positive note, can you share one of your success stories with someone you've worked with that's turned out very well?
That's a good question. Let's see. I don't know why my brain is just kind of going blank for a second. It's early here, and
I know it's early on the West Coast there.
Yeah, it's early on the West Coast. So in terms of of success story, I would say, I had a client who with a long eating disorder history, a long chronic pain history, and they I think what was most helpful for them is that yes, we spent some time talking about the chronic pain that they had, and we talked about the eating disorders, but we really dove deep into what was underneath all of that. And so if I use the iceberg metaphor, so like when you have the eating disorders and then the eating disorder chronic pain combination, a lot of what you're seeing is just the tip of the iceberg. It's the eating disorder behavior, the thoughts and feelings and behaviors that have to do with the eating disorder, and then the actual experience of the chronic pain. And so if you go beneath the surface, there's like, again, iceberg, like there's all this stuff underneath there. And so really digging deeply into that. So with this particular client, it was looking into past trauma and looking into kind of dealing with really, growing up in a really challenging family and stuff like that. And so what happened is that throughout the process, the client became a lot more proactive when it came to managing her pain. And then she was able to, come up with a system that worked for her, like things that she, would do on a regular basis that kept the pain at bay. And so that really improved her sense of agency of like, okay, I know what I need to do. If I have a flare up, I do ABC kind of thing. And so knowledge is power, and knowledge of your own body and knowledge of the help that you need and what like someone else in your situation may not need the same thing, but the help that you need, that makes a tremendous difference. And again, that helps kind of calm down your nervous system and calm down your brain, which helps with pain management.
Absolutely. Yeah. And I love that. And I love that you pointed out how, it's not that you will never have flare-ups, everything will be perfect. It's that, now how to manage that quicker and get yourself back to a better place quicker. And
for
I think
sure.
that's the essence of healing right there, is knowing what you need to do for yourself. Mm-hmm.
Right. And do preventative things, and so that you don't kind of pass that threshold where your pain gets really bad.
Yeah, absolutely.
I think that's also very important.
Mm-hmm. Oh, definitely. Yeah, completely. And just having that empowering knowledge of knowing what you need to do that's just crucial. Mm-hmm. The tools are absolutely crucial. Well, for anyone interested in connecting with you, where can they find you or contact you?
So I am on Instagram, Facebook, and then my website. So it's at Dr. Marianne Miller on Instagram and Facebook, and it's my Marianne is spelled Marianne. That might be somewhere on your website or on your little, post thing. But so it's at Dr. Marianne Miller, Facebook, Instagram, and then my website is drmariannemiller.com.
Very good. And I'll put that all in the show notes. So
wonderful.
To connect with you as well.
Yeah, that would be great. And then my next Freedom from Binge Eating class begins July 12th. And July 5th is the registration deadline. And I just finished the spring 2022 round, and it went amazing.
Awesome.
And I'm so excited about it. And it's, sometimes, if people just aren't ready for therapy yet and they want to kind of learn more about binge eating, and again, knowledge is power, it's I think a good place to start. And then, or if they're working on therapy with something else, anxiety, depression, whatever, and they have these like binge eating issues, and this is binging in addition to binging and purging, and they can come to the class as well. And again, it's knowledge is power, and then they'll also feel very heard, and they don't have, they can keep their cameras off and just type in, it's we want to keep people's privacy, and it just was, the spring class was so lovely, and I'm just so excited for the summer one. So
that's awesome. And it's such a great, that's available and easy for people to access that. That's amazing.
Yeah, because it's virtual and anyone, anywhere, it's from 12 to 1:30 Pacific time, which is 3 to 4:30 Eastern. So, you can, just hop on through Zoom. So
that's awesome. Well, thank you so much for sharing. And it's been such a pleasure having you on today. I really enjoyed our conversation.
So lovely. Yes, me too. Definitely.
Thank you. And everyone connect with Dr. Marianne Miller. She's a wealth of knowledge. So thank you again.
My pleasure.